Let us now go to visual diagnosis of the limbs. The topic is swelling of joints. A swelling of the joints of the forelimbs is always due to painful obstruction syndrome, especially that deriving from dampness. In chronic conditions, dampness develops into phlegm, which obstruct the joints and causes further swelling and bone deformities. In adults, especially women, it is very common for painful obstruction syndrome and swelling of the joints of the forelimbs to occur against a background of blood deficiency. If the joints are red and hot to the touch, in addition to being swollen, it indicates retention of damp heat. For damp painful obstruction syndrome, there will be swelling and pain of the joints, a feeling of heaviness of the limbs and the body. In case of damp heat, in addition to the above symptoms, the joints would be also red and hot to the touch. For phlegm in the joints, it will be long-term with chronic swelling and deformities of joints, osteophytes, a feeling of heaviness of the limbs and body, sputum in the throat, a feeling of oppression of the chest, swollen tongue with sticky coating with a slippery pulse. The forelimbs include the shoulders, elbows, wrists, palms, fingers of the upper limbs in the thighs, knees, ankles, metatarsus, and toes of the lower limbs. The relationship between the forelimbs and Zangfu are: the lung governs skin and body hair. Second, the heart governs blood and vessels. The liver governs tendons, and the kidney governs bones. The spleen governs muscles and forelimbs. All of the 5 Zang organs have relationships with the forelimbs, especially the spleen. According to the relationship of the forelimbs and channels and collaterals, the 3 yin and 3 yang channels of the hands circulate in the upper limbs, and the 3 yin and 3 yang channels of the feet flow in the lower limbs. Therefore, inspection of the forelimbs may help one understand the pathological changes of the channels and Zangfu organs. For knee swelling, if the knees are red, swollen and painful with inhibited bending and stretching, that's heat B with wind damp transforming into heat. If knees are swollen and tibias are emaciated, just like the knees of the crane, that's crane's knee with wind caused by persistent cold damp and deficiency of qi and blood. If knees are dark purple with diffuse swelling and are painful, that's external injury damage of the kneecaps or joints. If the knees are reddish, that is heat in the channel, and if it is bluish, that is cold in the channel. Thank you so much for your attention.